So hello everyone, this is Josh from SIBO Survivor and super excited to be joined by Dr. Michael Ruscio. A little background on Dr. Ruscio. So a lot of you might know him. He's pretty well-known functional medicine practitioner online and in kind of the gut health community. Dr. Ruscio, a little bit about his medical background. So he's a functional medicine practitioner. He's a lead researcher in pending IBS study. He does postdoctoral continuing education provider. He has a doctor of chiropractic degree from the Life Chiropractic College West. And his undergraduate degree was BS in exercise kinesiology from the University of Massachusetts. So he kind of has a wide background, and just from reading his bio, it seems like he came to kind of helping people with their health issues from a functional medicine, way of treating them, just from his own personal health journey as well, when conventional approaches didn't work effectively. And a lot of times that's what you see in some doctors and patients as well. They go down the conventional route and, they're given things to try and it's just not working. So they need to figure something else out. So I'm excited to kind of talk to Dr. Ruscio about, gut health, specifically SIBO and IBS, and, what people can think about and maybe talk to their doctor about if some of the conventional methods maybe aren't working, what else they need to look at. So first, I want to kind of talk to you about your experience dealing with patients that don't respond to typical treatment approaches. Like I said, maybe they've tried diet, antimicrobials, and other treatments for IBS and or SIBO, but just aren't getting better, or maybe they're relapsing. So I guess to start off with, what underlying issues or causes come to mind to investigate in patients who have IBS and or SIBO and just aren't getting better? And do you ever look outside of the gut?
Yes, sometimes we look outside of the gut. It's not highly often that we'll find something outside of the gut that's manifesting as IBS or SIBO symptoms. But you will sometimes see stress. Stress is one that you'll occasionally see someone who's doing well, and then all of a sudden they switch to night shift work, or they're going through a divorce, or something changed at work, or they had a child. And that's just thrown a lot of stress onto their system, and all of a sudden their GI regresses a little bit. And I should mention that, sometimes when people regress, they start to freak out. And I get it. It's really unpleasant to not feel well. But I'm here trying to throw a lifeline to people and telling them that if you freak out, you're not helping yourself, right? Because it happens to the best of us. Even some of the most brilliant clinicians I know, who know everything there is to know about gut health, have moments of relapse, because we are human, right? So there's this naturally expected kind of oscillation in how you're feeling. So don't freak out if you're having a little bit of a downturn. And sometimes what's needed to get yourself out of that downturn is quite simply tightening back up what you're doing. A little more rest, maybe a little bit less exercise if you're exercising a lot and not sleeping and under a lot of stress. Some attempts at stress management, maybe instead of exercising 6 days a week for an hour, now you're going to take a walk in nature with a friend and just kind of talk and vent about whatever was bugging you, and get that time to be in nature and have some social connectivity a few days a week. So sometimes the solutions aren't that difficult. Occasionally you'll see something like, there was one case I've talked about before of reflux, and the reflux we got under control, but they got gerbils for their daughter. And the mother actually was allergic to gerbils, and it was predominantly manifesting as reflux in her case. And so this ties in with histamine and histamine signaling and how histamine affects stomach acid. So in this case, unfortunately, they had to get rid of the gerbils. And once they got rid of the gerbils, the environmental insult, then recurrence of the reflux went away. So sometimes the solutions are nothing to really be alarmed about, okay? Especially if it's something due to environmental or lifestyle stress. and just try to remedy that stress as best you can, and understand that these regressions are sometimes normal and part of the game, and freaking out and falling into this pool of despair isn't going to help you, right? And I understand how sometimes it can be easy to fall into that pool because you go on the internet and you read, oh, SIBO is a chronic relapsing condition. You read these, very negatively painted prognoses, which I don't agree with, by the way.
Yeah.
And it's easy to kind of fall into that. But what I would offer people is that it's okay to have a relapse. Now, there are also sometimes things that you can do. For example, if you found a line of therapy that's worked for you in the past, then sometimes all that's needed is a brief touch-up of that therapy again in the future. And again, that may sound kind of obvious, but for some patients, they get really distraught when they have a relapse, and they think that something is wrong or broken. And the analogy I often use is if you sprained your knee really bad in college,
yeah,
every once in a while, that knee may shift and the muscles around it may shift out of balance. And so you may have to do some corrective exercises and some stretches and some foam rolling to get yourself back to balance. Would that mean, oh my God, my knee has this big issue, this smoldering, chronic, underlying, esoteric thing I can't figure out? No, you had an injury, and sometimes that joint is going to need a little TLC. If your gut got a little bit inflamed, every once in a while, your gut may need a little TLC, and that doesn't mean that there's necessarily any huge underlying problematic factor. There are some other things to consider too, like anemias and hypothyroidism, although you have to be very careful with hypothyroidism because, to be quite honest, it's a highly marketable condition. So everyone in functional medicine who's trying to build a practice is marketing about thyroid. And what ends up happening is you have these way overinflated claims about thyroid that simply aren't true. I don't think any of the practitioners are doing this with like a maniacal intent. But the functional medicine community is too overzealous with treatment. It's too marketable. And so it leads to, unfortunately, this ethos where many people are made to or led to believe they have a thyroid problem when they actually don't. But if you do have true hypothyroidism, then addressing that can be helpful. So, those are a couple things that come to mind in terms of if people are relapsing, where they may want to start with trying to turn the ship.
Yeah. So you do see, though, that, like everything, right, stress does play a role in the function of the gut, right? So it's important for people to minimize stress.
Yep. And that's been documented. We know that stress can provocate IBS, irritable bowel, gas, bloating, abdominal pain, altered bowel function, IBD, or more loosely termed, just functional gastrointestinal disorders. So yes, and we also know that stress, for example, one study has shown that college students under pre-exam stress show a skewing of their microbiota. Those who exercise too much tend to have immunosuppression and more of a tendency toward overgrowth and infection. So yes, stress in its multitude of forms can negatively impact your gut. Yeah.
Cool. So I guess my other question, kind of coming off of that, is do you ever see a link between like a hormonal issue or something in the endocrine system that could be causing like the chronic fatigue or something to that degree?
Well, thyroid is one that would come to mind in that case. And this is where having a fairly standard evaluation for a thyroid problem. And I want to touch on female hormones also, but just really quick on the thyroid. You want to know as a patient, are you truly hypothyroid, or do you have some kind of functional imbalance in your thyroid hormones? The functional imbalance typically means that nothing is wrong with the thyroid, and you've got to clean up stress and inflammation somewhere else in the body, oftentimes the gut. So it means nothing's wrong with the thyroid, even though some thyroid markers may skew. The source of the problem isn't the thyroid. Right? It means the thyroid gland's making hormone just fine, but when that hormone gets out into circulation because there's inflammation, the hormones aren't working properly. So that can be called a thyroid problem, but it's really not a thyroid problem. Right? The gland that makes the hormone is just fine. It's just in the periphery of the body where the hormones are metabolized. If there's inflammation present, that metabolism is thwarted. So it's important to delineate the difference, because one, if you're truly hypothyroid, usually requires thyroid medication. The other usually requires cleaning up an inflammatory or stress issue, oftentimes, but not always, coming from the gut.
Okay. So, So in that case, where you're talking about the inflammation coming from the gut, right? So is that would be more of a case where maybe the gut would be kind of causing the issues, right? Instead of the thyroid having actually production issues, which are causing the problem.
Precisely, precisely. So you can have thyroid-like symptoms that are ultimately being driven by a problem in the gut. And we've on our website published a number of case studies where patients have come in thinking that they have a thyroid problem on thyroid medication and thinking they need to do the more involved thyroid assessment or be on a different, better form of thyroid medication, which I'm open to. But we took some time to clean up their digestive health. And I believe now we've documented at least 2, maybe 3 cases where people have been able to reduce their thyroid medication at the same time have better fatigue, better body composition, joint pain, and digestive symptoms, because we got rid of the insult to the gut that was thwarting their absorption of the medication, firstly, and then secondly, diminishing their ability to effectively metabolize that medication once it got into their system. Mm-hmm. So yes, it is possible to have thyroid symptoms. Again, these are very broad and non-specific anyway, that may ultimately come down to a thyroid problem. If someone is truly hypothyroid, that's fairly easily sussed out looking at the conventional ranges of TSH and T4. If TSH is high paired with below T4, then you're hypothyroid. If that's not there, then the problem is likely somewhere else. And there's also female hormones, which you do see a fair number of cases where the female hormones seem to be a bit imbalanced. And this is why in my book, even though the book was all about gut health, there was one break-off section about the female hormone gut connection, because I've seen a number of females that their digestion and their female hormones both go south. And when you support the gut and give the female hormones a gentle push with some herbal medicines, then everything tends to respond together really nicely. And we do know that female hormones do affect motility in the gut. And there's a fair number of progesterone receptors in the colon. And that may be one reason that some women have constipation. And it's definitely something that is easily observable if you notice that your digestive symptoms get worse, when you're in your premenstrual time of your cycle. So there's definitely that connection there also.
Awesome. So I'm just curious, just since you mentioned it, your book is called, what is it called? Healthy Gut, Healthy You?
Healthy Gut, Healthy You.
Awesome. Yeah. I actually haven't read it yet. I'm going to read it soon. So next question here, just continuing on kind of, maybe someone's tried the conventional therapies, right? And they're looking for other things to help them along their healing journey. So what other tools or, type of treatment options have you found helpful when normal methods aren't working?
One of the things that I've found that, again, may sound basic, but, as someone who sees quite a number of my patients who have seen a few conventional doctors and a few alternative doctors and still haven't gotten to where they want to be, I can say that sometimes a solution to these problems is not something exotic, but rather just revisiting, well, firstly, understanding what the tried and true therapies are, and then knowing how to apply them in the correct fashion for a patient. And so sometimes what people do is they start with the therapy that has all the craze about it on the internet, and they're putting the last treatment first in the hierarchy, and they're not succeeding because of that, right? And to use a trite example, if you built your roof before you built your foundation, what kind of house would you have, right? So sometimes getting the sequencing correct is literally the difference between success and failure. And so we want to start with the foundation of diet and lifestyle. And I outline this all in the book again. We want to start with the foundation of diet and lifestyle. Now, the lifestyle piece, not that hard. I think most people have heard the main tenets of a healthy lifestyle. The diet might be a little bit less clear cut. You have a few options. I'm sure you've probably discussed these. You have paleo, you have autoimmune, escalation to autoimmune paleo. On the other track, you have low FODMAP, and then perhaps what I call a paleo low FODMAP. And then maybe at the apex, you have kind of a combination of both of these tracks, which is your low FODMAP with SCD diet. And that sounds maybe like a lot, but you really only need 2, maybe 3 weeks to evaluate if the diet is helping. It's not to say the diet will produce all of the potential impact in 2 to 3 weeks, but after 2 to 3 weeks, you should be able to say, yes, I'm clearly feeling improved, or no, I don't really feel any better. If you don't feel any better, move on to the next diet. If you move at that cadence, then you can run through all or the major available diets that I just outlined in a number of weeks and figure out what diet might be best for you. And then from there, you move on to kind of the second. I always picture in my mind kind of this pyramid model. And so we start with the foundation, and then we build upon that, and then we build upon that. And you keep building until you get someone to the level of improvement that they're looking to effectuate. There's one other dietary twist I should mention you guys have probably talked about, which is the low histamine diet. And low histamine can be helpful for some of those cases that they really haven't seen the traction with any of the other diets. Restriction dietary histamine can also be very helpful. And with all these diets, there's good news in that you don't have to be on them forever. Typically, people are able to reintroduce and broaden their diet after a number of weeks or months on the diet, plus or minus perhaps some other therapies to continue the gut healing. But the longer term objective should be, and you should be able to get to a point where you're expanding your diet. Gotcha.
So it's really important to, like you're saying, to build that foundation, right? And you're saying, do you see in a lot of patients that, diet is very individualized, where maybe they'll have to test 2 or 3 different diets and, kind of come up with a range of foods that are healthy that suit them? Is that what we see a lot?
Yeah, it's very individualized. And I actually think that's one thing that trips some people up is they're so focused on the rules of a given diet they've been told to do or think they should do, that they start following that at the exclusion of looking to their own experience and their own reactions or lack thereof. Mm-hmm. And these diets are just navigating pillars to help you run through, okay, I'm going to focus on this group of foods and see how that goes. And I'll probably learn from doing that. There's a number of foods that I'm fine with, but a few triggers I've identified. Great, take that, move forward. You don't have to continue doing that diet and the next diet and the next diet, but you want to use each diet to help you identify what your triggers are so you can then create a customized plan, quite simply, of just eating the things that don't bother you and being careful with the things that do bother you. And so sometimes it's just having the ability to be okay with violating one diet's rules because you're going to another or kind of hybridizing them is totally fine. And then there's one important kind of backdrop there, which is if you've done a decent shake with these diets and you still don't feel like you're where you want to be, then we have to intervene further. And so we don't want to wallow in diet for too long because sometimes there's a non-dietary solution that needs to be initiated or implemented. So we want to give diet its shake, but if we're not where we want to be, then we fairly quickly move to other therapies.
Gotcha. So after the foundational, diet and lifestyle is really the foundation of all treatment, right? And then what are the next steps above? Is that when you get more into the, the antimicrobials or the elemental diet and things like that?
Well, I think that unfortunately probiotics have not been given their just deserves.
Yeah.
And we've, in our clinicians newsletter, have published 3 cases where a patient with IBS, and kind of confection of symptoms, because you typically will see, let's say, loose stools, abdominal pain paired with fatigue and joint pain, right? It's very rarely is it just digestive symptoms, but you have this confection of different symptoms. And what I had been doing for a while was on day 1, having them test, and then immediately after they collected their tests and while we're waiting for the results, they would then go on a probiotic protocol. And I break all probiotics down into 3 categories. So I gave them one formula from each category. Mm-hmm. So they have a nice broad probiotic stimulus, which, by the way, are powerful antimicrobials, probiotics, ironically. And when we saw the patient back anywhere from 4 to 6 weeks later, we found in all these cases some type of dysbiosis, whether it was SIBO or Candida or SIBO and Candida or Blasto or Blast 1H pylori, whatever it was, all their symptoms were now gone after being on the probiotic protocol for a month, making the lab results kind of obsolete and making the need for direct antimicrobial therapy obsolete. Okay. So, I do think, unfortunately, the probiotics are being overlooked. And I think some of that comes from a community I love very much, the SIBO community. I think there's some realms of opinion in the SIBO community that would have one believe that no one with SIBO should use a probiotic, even though that is a direct contradiction to what the best evidence tells us. There's a number of clinical trials showing that probiotics can combat SIBO. In fact, one novel trial showing that if you take two groups of patients, they all have IBS, one has IBS and SIBO, one has IBS without SIBO, it's the group with IBS and SIBO that sees the better results from probiotics compared to the other group. Yeah. So, where the thinking that you shouldn't use probiotics if you have SIBO comes from is beyond me. Now, does that mean that everyone with SIBO will respond well to probiotics? No, no one will respond well to probiotics. SIBO positive or negative. That's not the point. The point is leaving out or not leaving out a therapy that can be very helpful for SIBO because it theoretically doesn't make sense. Meaning, why would you give bacteria in a syndrome with too much bacteria to begin with? Well, because these bacteria, these probiotics, can actually function quite antibacterially. So probiotics is one important piece to make sure that you've tried a category, what I call 1, 2, and 3, Lactobacillus bifidobacterium blend predominated probiotic, a Saccharomyces boulardii probiotic, and a soil-based probiotic. And I outline all these specifics. I'm not sure if you want me to refer to the book or not, but I'm just trying to steer people going through it kind of fast here. But if you want to know, what the exact formulas are and what the dose and the duration, all that's outlined in the book. I'm just trying to run through this kind of from high level so people know what hook to grab depending on where they are in the process.
Definitely. And I can put a link to the book after this. So I guess one question going off of that about the probiotics is, do you recommend any specific strains or is it just mainly one from each category to try?
Yeah, and that's also another great question. And one of the things that you'll see is there's a study on one probiotic formula, and then the manufacturer of that probiotic tells you why that's the best probiotic. Yeah. But they're leaving out that other similar probiotics have shown similar effects, right? And so, I mean, in part, I get it, right? These supplement companies are trying to generate sales, and that's fine because probiotics are getting way better and way more affordable. And so it's okay to be a business trying to generate sales, trying to bring up the quality and down the cost. There's nothing wrong with kind of that capitalistic driver of a supplement company. But what becomes challenging is when you as a consumer are using all this info marketing to inform what probiotics you use, right? And so it's kind of silly to get your education from the company who's making the product, right? So what I've found to be helpful for people is going through an intermediary, like some kind of healthcare professional, to help you navigate and parse through what the research shows. Yeah. What the research shows is that these probiotics, different formulas, all tend to perform pretty well. Yeah. So I think it's a mistake to say one formula is vastly better than the other, but you do see this trend emerge where there's a handful of lactobacillus and bifidobacterium formulas that you want to make sure to include in your category 1 probiotic. Yeah. And then in category 2, Saccharomyces boulardii is just Saccharomyces boulardii. And then in category 3, the soil-based probiotic, there's maybe 2 to 5 different strains of the Bacillus species you want to make sure are utilized in that formula. So there's a number of products kind of for each one. In the book, I lay out the ones that I use and that I like. But the more important thing, and I think what eludes people, is if they don't understand the category system, they end up trying a category 1 probiotic called, Gut Healer 5. And that gives them, okay results.
Yeah.
Then they try another probiotic called, Healing Probiotic 7. It's the same exact category, and they have the same results. And then they go to another probiotic with a different name. So all the while they're trying different formulas of the same category, never trying a category 2 and never trying a category 3. So understand the category system. You can try one good formulation from category 1, see how you do, either keep it in your regimen or get rid of it if you have a negative reaction, move on to category 2, potentially keep it, and then build yourself a personalized probiotic protocol that's either one or a combination of the 3 categories.
Gotcha. Last quick question about the probiotics is, you said that do you see patients that do bad with probiotics? And what are the signs someone should know if maybe probiotics aren't right for them at that time?
Well, what you're looking for is any kind of negative symptom that occurs proximal to when you start taking the probiotic formula. It's not to say there's one symptom that denotes this. Some people might get constipated. Some people might have loose stool. Some people might have abdominal pain. Some people may notice that they have some reflux. Some people may notice that their histamine-like symptoms are getting worse, meaning they're brain foggy and irritable and fatigued. So it's not to say that there's one symptom, but if you see the symptom occur proximal to when you started taking the probiotic, then that tells you that obviously the probiotic is the source of the problem. Now you want to give yourself 3, 4, 5 days before you fully make that adjudication, because you can have a little bit of turbulence at first that's transient, that's not abnormal, right? This is sometimes termed as a die-off. So you don't want to rush to drawing that conclusion. You want to give yourself 3 to 5 days. And if you're someone who's highly sensitive, I would start the probiotics one at a time. Every 3 to 5 days or so. Start on one, fully run that course until you can say it's helping or it's causing a negative reaction. If it's causing a negative reaction, wait a few days until you feel like you're back to baseline, and then add in the next one. And if you do it that way, it's very easy to see where benefits are coming from, where reactions are coming from, and proceeding accordingly. And that's actually another important tenet in functional medicine, which is simplifying your treatment. Because especially if you're a sensitive patient, if you do too much, if you do multiple lines of therapy at once and there's a reaction, very hard to know where that reaction is coming from. Very hard to learn from that negative reaction. If you're doing things one thing at a time, you can figure out what works, learn from that, what causes reactions, learn from that, and learn someone's system in a stepwise fashion. So it's a little bit more of a tortoise approach than it is the hare. But we all know what happens at the end. The tortoise ends up winning with the slow, steady approach.
Yeah, so you want to basically conduct it like a scientific experiment and control the variables so that you can find out results based on one thing. So
exactly.
I guess lastly, kind of just to finish off the pyramid, what are kind of the last, so, the foundation is diet and lifestyle, then you get to probiotics, and then what's after that? The last things that you usually tweak or test with people?
Mm-hmm. There's a few other things to escalate through. Okay. Antimicrobials are one. And a few thoughts regarding antimicrobials. If you're new to antimicrobials, then I would just run an antimicrobial protocol. We have one that we call for in the book, which is essentially 2 formulas for the first month. We switch to 2 different formulas in the second month. Okay. And for many people, that's going to be helpful. Now, for some people, that will only be partially helpful, or they will notice they regress right when they come off of the antimicrobials. And so in that case, you can then do another round of antimicrobials, but escalate to the addition of antibiofilm agents. Now, antibiofilm agents with SIBO, there's no documentation other than one retrospective chart review that we performed at our office. So we were able for the first time ever to document that the co-administration of antibiofilm agents, which help break down this coating over SIBO and other bacteria and fungus, the co-administration of antibiofilm agents that break down that film along with the antimicrobials had better efficacy than just the antimicrobials alone. Okay. Now, that's just one study, but we were able to show a statistically significant impact from doing that. And also, some people semi-habitually notice that when they come off antimicrobials, they regress. And I think for those people, they need to revert to a lower dose, longer term kind of tail of antimicrobials. There's controversy about that. Some providers think that when that occurs, there must be a motility issue present, and you have to go hard, into motility. I'm open to that, but I have not been impressed with, other than a small number of cases, the utility of aggressive post-antimicrobial prokinetic therapy when compared to a low-dose antimicrobial therapy. And the stronger you get with the prokinetics, I mean, the potential more side effects there may be, although I do think prucalopride, or aka Resilor, is a fairly safe drug with a fairly minimal side effect profile. If I look at that drug compared to 2 pearls of oregano per day, I'd rather have someone on 2 pearls of oregano per day rather than having them on a prokinetic. I'm open on both, but my kind of no BS candid take here is that one of the preeminent researchers in SIBO, a very smart gentleman who I respect and appreciate his work very much, he's also a motility researcher. So I think it kind of skews the narrative to be very centered around motility. Which, again, it's not to say it's right or wrong, but I think because he operates in that motility vertical, that you see much more of the recognition skewed around motility, which I think is probably the issue for much less people than we've been led to believe. And I've been testing that theory in clinic, and it seems to me that patients do really well with just a simple tail of low-dose herbal antimicrobials. We are trying to do a study looking at herbal prokinetics in the prevention of SIBO recurrence. We hit a few roadblocks in being able to get that off the ground, but we are dangerously close to starting that at our office soon, and I'll be very curious to see what we show. And another strategy that can be used is also an elemental diet. And just briefly on the elemental diet, I also expound upon this in the book. You don't have to only use the elemental diet in a 2 to 3 week exclusive application, as it's been discussed for SIBO. Now, why I think you get that narrative on the internet is because in the one study in SIBO, it was used for 2 weeks plus. Okay, great. But in the wealth of studies looking at this for inflammatory bowel disease, there's a much more kind of liberal use, and even something known as the hybrid application, which I also detail in the book, which is essentially do your short course of exclusive elemental, anywhere from 2 to 4 days up to 2 to 3 weeks. I think anywhere there is fine. And then once you're feeling better and like you're ready to get back on whole foods, then transition to what's known as a hybrid approach, where you can use the elemental meal replacement shakes for roughly half your calories in the day, and then have the other half from whole foods. And for some people, this gives them a nice kind of break for their digestion while they're having the liquid meal. And then they have some whole foods. And if you think about it, this shouldn't sound like a foreign concept. How many people wake up in the morning and they have a smoothie on their way out the door? Right? So we're essentially doing that same thing. It's not like this is some weird quickie concept. Many people have a quick liquid breakfast. In this case, with the elemental formulas, these are just hypoallergenic formulas that are also very gut friendly. And the newer crop of elemental formulas, of which we've actually released one that I'm very proud of, are very, very palatable. So don't get pushed off the recommendation because someone told you that they taste really bad. That's true for the older versions, but the newer versions are actually quite easy to take.
Yeah, and that's a great point, because I've even used kind of that strategy myself a little bit, just because, when stuff like flares up a little bit or anything, that's one of the easiest ways to kind of get back on track, is just allow your gut some rest and give it some time to recover. Awesome. So I think it's a good point to wrap it up on. It's a ton of great information that I think my audience can learn from. Lastly, so your website is drruscio.com, correct? And then what's the name of your book again?
The book is Healthy Gut, Healthy You. It's available on Amazon, both as paperback and Kindle. And then, yes, the website's drruscio.com, which is drruscio.com.
Awesome. And then the elemental diet supplement that you created?
That's called Elemental Heal.
Awesome. Cool. Well, thanks so much for joining, Dr. Ruscio, and we really appreciate you coming on to share your knowledge.
Yeah, been a pleasure. Thanks for having me.